This is Average Joe PT. In our last episode, we specifically talked about shoulder pain and the difference between a tendonitis, a tendinosis, and a peritendinitis. So I'm going to leave a link right up there, and if you want to look at that, hopefully you'll look at that after this episode. So we're going to specifically look at how do you tell the difference between knee arthritis and a meniscal tear. Because when people start having an injury, let's say they do a twist or they do a quick turn and all of a sudden the knee catches, the first thing they think of is, uh-oh, I either sprained it or I have a meniscal tear. But the reality is a lot of times you might have just a little bit of arthritis or the scary thing, a meniscal tear. So we're going to talk about how do you really tell the difference between the arthritis and the meniscal tear. So let's go ahead and get started, and hopefully you'll leave a thumbs up and a like so that we can go ahead and push this video out to other people. So we're going to pull back this kneecap and we're going to specifically look at these two blue things. These two blue things represent the meniscus, and they really tell the story of if you have a tear or not, because if there's going to tear, this knee is going to bend up and down and it's going to catch on that tear. Things are going to get swollen and inflamed and all of a sudden hurt. So what's the real reason why we have these meniscus is because they are oddly shaped to make this bone, your thigh bone or femur bone, and your shin bone or your tibia to really work with one another. And what we call that is congruence. And so when one of these blue things tears, and all of a sudden this bone and this bone aren't going to work with one another really well when we go ahead and bend and straighten or flex and extend the knee. And there's three things that you really want to look at is if you have arthritis or meniscus. Number one, if you're bending and straightening your knee and it feels like it catches or locks on you, right there we're looking at a meniscal tear. That's number one right off the bat. That's not arthritis. Number two, if it does catch and makes it feel better, and then the next day it catches again and hurts and feels better the following day, and then catches and gets hurt again, that is also indicative of a meniscal tear. In that situation, you really don't have a bad tear, but you have enough that it keeps, as the knee bends and straightens, it gets floating in there and then catches on the two bones that pinch together. And then the third one is if you're having a lot of swelling along the entire joint line here, and it does one of those things, catches, or if you're pivoting and twisting and you can barely do it or can't do it at all because you have instant sharp pain, that's also indicative of the meniscal tear. Now, if we're dealing with just arthritic type pain, is when you can twist and you can pivot, but it kind of aches. It doesn't really give you a sharp shearing pain or feel like you can bend or straighten the knee, but it just kind of throbs and aches. If you just have pain along the joint line here and no pain specifically on one spot, then we're really dealing with arthritic pain. That's number two. Number three, if it feels like it's stiff in the morning and as you get moving around during the day it feels better, that's classic arthritic type pain. And arthritic pain, and we've talked about this in other videos, I'm going to go ahead and leave a link up there. It basically goes over arthritic issues in the hip, but it's the same kind of symptoms. In the knee, what we're dealing with is this nice bone has shiny tissue on it called cartilage, and when it starts to wear or thins out, it literally becomes like pits. Like if you were driving on the road and you had a pothole, those are pits in the road, and exactly what would happen here when you go on a nice smooth surface and hitting pits, it kind of catches and that area gets inflamed, gets swollen, and then aches. So that's really three significant indicative issues and symptoms when we're looking at arthritic pain versus meniscal pain. Now, if you're thinking like maybe I have both, yes, it's absolutely possible to have both arthritis and a meniscal tear. What happens sometimes is people live with a meniscus tear. If it's not a bad tear and you're not very active, then you can go ahead and live with that. Now there's not much blood flow in this area. It's literally on the very outer part of the joint on the outside of your knee. Other than that, really the meniscus is nourished by synovial fluid, and so that synovial fluid really doesn't, it has no blood flow in there. If you actually accidentally, for some sort of trauma, get blood flow within this knee joint space, that's a bad thing, because blood flow actually destroys cartilage. It actually chews it up. So it's the last thing you actually would want in the center of this knee joint would be blood. So if you guys have any questions, go ahead and DM me down below. I'm going to go ahead and leave another link up here. It's just some generalized exercises you can do for the knee. And until next time, I always like to say, look up and keep smiling. See you next time, folks.